I say, I will just first give some general tips. And let me stop at this point. Please, today is health talk, it's medical talk. There will be time for question and answer. So you can get a paper and a pen, write any question that has to do with health. Give it to the usher. Ushers, please, they will give you their questions on anything, whether it's you or your relative or somebody that is close to you on health. As time will permit, we'll see how we can answer them. Praise God, I also have some health people that know about health, so they are going to help me with that. If there's any question I cannot answer, I will just look around and I'll trust some people I know. So if you know that you're a health person here, just wait for that one. But that's by the way, let's write our questions to be able to answer by God's grace. So I'm going to start from simple things before we go into some big things if we have more time. So how do you live a healthy life? Remember the topic is healthy life is a prosperous life. I'll start from simple things. The first one, clean environment and body hygiene. It may look simple to you, but many people have died because of it. Clean environment and body hygiene. Look at your nail. Everybody, look at your nail. Look at your nail. Don't look at other people. Look at your nail. Put your hand like this. Is there any black thing under your nail? Check. Some of us are saying no. I will ask your neighbor to check for you now. Because when you scratch your body or your head, you will notice some few things under your nail. True of us. How many of us notice that one? But the problem is, that's just the problem. We don't notice it. So if you keep long nails, or if you use artificial nail, there's nothing wrong with it though.
Something wrong.
Sir?
Something is wrong.
There is nothing wrong.
It's not from God.
That is, I don't want to spiritualize things. There is nothing. Somebody is keeping me to go to heaven. It's not a qualification for heaven. That's why I said today I'm a doctor. There is nothing wrong. It's fashion to keep nail. But then it can cause trouble for you. If you don't know how to keep it clean. If your nail is long, if you want to scrap your body, do you use ruler to scrap yourself? You still use your. When you scrap it, you acquire some. See, the way we move around, there are dust everywhere, there are germs everywhere, even on our skin. So when you scratch some things, it keeps under. Are we getting it now? It keeps under. When you go on different activity, your hand is dirty. If you don't know how to do hand wash, the next time you visit your friend and he offer you a cake, you are going to collect and eat. True of us. How many of us will go and wash our hands before we come and collect the cake from our friend? Or sweet? How many of us do that one? But then germs, and then it can lead to infection. Simple hygiene. When we talk about, we are talking about the first one, clean environment and body hygiene. So hand wash, I even having bath. Some of us have crop in our body. Some of us we don't bath regularly. We are in church, nobody is going to raise hand. For some of us, especially during December when it's very cold, some people just do wash face, wash hand, wash everything. Off they go. Lecture want to start, sharp. Want to go. Eczema. Sharing towel, sharing handkerchief, sharing so many things. Germs can come and somebody can get disease. Menstrual hygiene, see part of body hygiene. If you are a lady, you don't know how to take good care of yourself, it can cause problem. You know, sometimes somebody may be a very good Christian. She is not promiscuous. She doesn't sleep around. She doesn't do anything, but you may find it difficult to give back to the child. I now start wondering, even though they are doing abortion, because the menstrual period, the menses you see, is blood with some things, some body tissues. It's very rich. The blood is very rich. Actually, what come out that women see as menses is what the womb prepared to nourish a baby. So if a man has sex with a woman now, a baby is formed. The baby that is formed gets attached to the womb. The womb prepared to nourish that baby. Nutrient, everything is there. But once there is no pregnancy, the body pushes it out. I'm making it simple now. That's what you see as menstruation. The body pushes it out. So it's very rich. So if you don't know how to clean up very well, you don't change your pad timely, you are careless with it, infection can set in. And from the vagina, we're all adults here, so don't start looking. Hey, pastor is mentioning something. Some of us are too spiritual more than the spiritual people say. From the vagina of a woman, it's open into the cervix. The cervix open into the womb. The womb has tube on both sides and open to where the ovary produces the egg. Once there is infection, it can follow that same path from the vagina to the cervix to the womb, through the tube and outside. That way, that infection is not treated, can block the tube. For a woman to get pregnant, the egg is released by the ovary. From outside, it will be channeled into the tube to go into the womb where it will be fertilized. So if there is any obstruction in the tube of a woman, the egg will not have contact with the sperm. That is one cause of infertility. There are so many problems. So we are talking about menstruation now. That's what I'm saying. We're talking about body hygiene. Are you getting me now? So if you are not hygienic with your menstrual period, if you are very careless, and it's even worse if you are sexually active, because somebody else can actually transmit sexually, and you have sexually transmitted disease. Once it's in the vaginal area, it can enter, especially during menstrual. I mean, you are not taking care of yourself, you can go the same route through the tube. Gonorrhea damage the tube of a woman and the tube of a man too. So you see the problem now from body hygiene, serious problem in the future about giving birth. There are so many other things. I'm talking about body hygiene and we're talking about staying healthy. So body hygiene is very, very good. So for our ladies, please be very hygienic, especially during your monthly period. I'll go to diet. We're talking about how to live a healthy life. Number one, watch what you eat. Many a time these days we like quick food. All these with the meat, all these cake, pastries and everything. They are very good, there is nothing bad with them. But most of them are high fatty food. And they contain some level of cholesterol, lipids and some other things that are not healthy for the body. If you eat too much of fatty food, the body will take the liquid it needs and store the rest for you. Some of them are stored along the blood vessels, small, like deposits along the blood vessels. And over a period of time, they start to narrow the blood vessels, like the blood, like a tube, like the pipe that carry water from the water board to our house. Not the pipe now, ordinary normal pipe. But you know if the water from the water board is dirty, small dirty will be having. Have you seen pipe that is clogged by dirty before? That's the same way fat deposits narrow. You just get deposit along the wall. You now start to narrow the blood. Therefore, the heart have to use strong power to pump blood through the narrow blood vessel. Because the heart is working too hard, it starts to expand unnecessarily. And over a period of time, that's how it causes hypertension. Can you see the link from what you have eaten to what you be? How many of us have seen goats being killed before? The heart, you see some fat or chicken around the heart. The body has a way of depositing fat in different parts of the body. Even the liver, some of us that take alcohol, the body deposits the fat. How many of you people that drink alcohol? When do you know that people that drink alcohol? Their tummy is always like what? The bed will be inside, the tummy will be big. The fat is deposited in the muscle of the abdominal wall, in the liver. They always have big liver and it destroys the liver. So what you eat, what you drink is very, very important. So eat more vegetables, drink a lot of water, take a lot of foods they contain vitamins and minerals that are good for the body, and eat balanced diet. Avoid alcohol, I will come to that one later. And avoid skipping. Some of us are assistants say they are watching their weight. You don't want to put on weight, you will not eat. You will not eat, go and develop ulcer. You see one problem, you are trying to solve one problem, you are creating another problem. Somebody says watching their weight, you don't want to put on weight, but biscuit come, go on. Meat pie, go on. Cake, go on. All those items, they say, I will not eat, I only eat once a day. But if you sum up all that they have eaten since morning, it's even worse than somebody eating 3 times a day. So you are watching your weight, but you are not watching what you are eating. So don't say you are watching your weight and go and develop ulcer. It's very, very painful, very terrible disease. So diet is very, very important. Third one, I will go to exercise. Regular body exercise. You must avoid idleness. Your body is made for motion. Your body is made to move around, not to stay in one place. One of the causes of hypertension is sedentary lifestyle. People that don't move around much, they just stay in one place, or people your work is such that you sit down in the office, don't do anything. Once you come to the office, you sit down. Your work does not allow you to exert energy. It's a predisposing factor later in the future. So, but body exercise is very, very important. When you do exercise, it increases blood flow in your body. Blood circulates very well, distribute nutrients, distribute oxygen, distribute glucose, so that every other body part can improve. When you do exercise, it improves your sleep. You are able to, at the time that doesn't really have problem with sleeping, just exercise yourself and go and bathe. Before you know it, once you hit your bed, you will go. Because the body wants you to rest at that time because it has exact energy. It will want to recuperate. Are we getting? So if you do regular exercise, you have problem with sleep unless there are some other problems. If you do exercise, it prevents obesity. But whatever you eat, the body will take what it needs and push out the rest. But sometimes if you keep it and you start gaining weight, obesity is associated with diabetes, with arthritis, and with so many other problems. So when you exercise, you prevent what could lead to hypertension, diabetes, arthritis, other things. It also increases your confidence. Because you are slim, fit, and healthy, I mean, you look good, it boosts confidence. The mind that, oh, am I fat? Am I too big? All those psychological effects will not be there. So, body exercise is very important. And you can do simple exercise. Number one, walking. You don't have to run from here to university. Just walk. If you are in a hostel, just walk from university to teaching hospital. If you have the strength to custom and walk back, that is it. But do you know you can do the same thing, Daddy? Inside this church. I started with that one because that's what most of us see as exercise. From this gate that you are seeing here to the end of this fence, you can walk it 1,000 times if you choose. If you put everything together, go and measure it if it's not up to where I was talking about. But you have not left your house. True of us. Most of the time we give excuse. We always look about the big thing, but the small things matter when it comes to our head. Just walk around. 30 minutes walk. Just leave your hostel, walk to the next hostel, and walk back. So if you walk, that's one simple exercise. You can do what they call jumping jack. This one is just like this. It's just to extend your. In one place, you are not leaving your room. Two of us, you do that one for about 3 minutes. You stop. You do another one. By the time you do it for like 10, 15, 20 minutes, you start sweating. You have done your exercise. That is one. How many of us know about skipping rope? I don't think it costs more than 1,500. I don't know how much. If you want to, God bless you. If you can't find skipping rope, go to where they are selling nama. That local one. Nobody will know. Now inside your room you did. Do it. You can do that one. It's a form of exercise, and before what you are trying to do is to exercise your body. You can, how many of us do, okay, we know about push-up and press up back. How many of us do that one? In your room, only one hand. Seriously? Let me see your hand. If I call you to come and do 200 here, how many of us will do 200? Who has the highest here? We are in church, oh, don't lie. Don't lie. We are not impressing everybody. What is the highest you have ever done? I saw you raising up your hand. 40. God bless you. That's good though. Who has done more than 40 at a time? How many? What is 40 upward? You are in the same category. Who? I clap for you. Who has done more than 100? Don't lie, you are in church. You don't have to do 100, but what we are saying is that do it. It's a form of exercise. There's another one that is body weight squat. This one is just like this. You do it. You just do it. Are you getting it? All those ones, you don't have to go outside. But if you do the same thing, it will give you strength. It will help with your heart. It will help with your body, with your muscle. And then you'll be healthy. It's very, very important. Dancing. Just put on your music and dance. You know that a dance you can dance and start sweating. Sure of us, you dance and start sweating. It's a form of exercise. You can swim. So there are so many things that you can do. You don't have to. Can you see all the register now? I've talked about. Did I say you should go and register in the gym and somebody collecting your money? If you have the money, please go ahead and do it. You can even hire a personal trainer. If you get money, it's part of it. Are you getting? Do your exercise. So you can have a partner that you work so that you won't get tired. Exercise is very, very important, and you can do a mix of all this one. Next one, I will go to self-body examination. We are talking about healthy lifestyle. The other one was body hygiene. This one is self-body examination. That is, you are your own doctor first before you visit a doctor. Self-body examination. There is something that a scripture that applies that I'm always conscious of. The Bible says Matthew 26 verse 41, watch and pray. Do you notice that the Bible does not say pray and watch? Some of us, when we read our Bible, just try to, what does the Bible say? Say watch and pray. Before you talk to God, He asks you to use yourself. Watch. When you watch, you know what to pray for. When you look into your life, say things are not working for me, you are watching. You try to examine your life and okay, which area is not working. Then prayer point will come. True of us. The same thing in your head. Before a doctor will come and examine yourself, watch yourself. I'll give us some example. Under self-body examination, you can do self-skin examination. Just look at your skin. There are some of us that have this small black thing, like small pimples, black, very dark on our body. Some of it is like mold. Some of those things, don't get scared. I'm not scaring anybody here. I'm a doctor, I've seen many things. Some of them can be cancerous. Some are just ordinary, they are just benign, they are just there, they are not causing anything, but some of them could be cancerous. Much more later. So if some things are not in your part of your body before, you can check your body. Eczema is there. You don't need the doctor to tell you that you have eczema. All of us know eczema, eh? Crop. That's the normal thing for you. Check your body. Feel your body. Is there any part that you see like a small lump or something? that is not supposed to be there. Just check your skin. Is there any reddish part? One area that is darker than the rest or reddish in color? Is there any bruise, any small thing? You start bleeding. That may be simple signs to you, symptoms of something deeper going on in the body. So we start from that one. So is there any rashes? Is there any peeling? Is there any itching? Is there any bruise? You can detect allergy by yourself. What are you allergic? I know that I'm always having these rashes anytime I bath with cold water. I may be allergic to cold water. You are using a particular cream or some body lotion, you may be allergic to it. Just do self-examination, self-skin examination. The second self-body examination we'll talk about is breast examination. We lost somebody about 2 months ago, Reedemers member in my local church in Abuja to breast cancer. Very young woman. I think her first child is in primary school. Reedemers member. Are we going to say we are more holier than her? No. I'm not blaming her, no. But I'm just trying to tell you that for us Christians, we are not immune to some things. Once it pleases God, there's nothing we can do about that. And please, that's why I said, I say, don't say it can't happen to me. Just take care of yourself. Praise the Lord. So for our ladies, more than for men, men do have breast cancer, but more for our ladies. Just stand before the mirror. Some of us, the only thing we use our mirror for is to powder our face. That's the only thing. The one in the house is not enough for me, including myself and my wife. Sometimes we want to drive out, she will still put the one in the car. She will still do it now. There's another one in the purse. I mean, I'm not, that's why I'm part of her, she's part of me, so we are together. I'm blaming myself because my wife does. So I'm not blaming you before you see what pastor talking about. But stand before your mirror, remove your bra, and look at your breast. Because it's very common, breast cancer. It's very easy to treat if you discover early. But once it goes beyond certain period, there is nothing anybody can do. It's just palliative treatment. So just look at your breast. Is there any change? Look at the two breasts. Normally, one is usually slightly bigger than the other, but you will not even notice the change. Just look at the two breasts. Is there any change in color in any part? Just look at the first one first, maybe the left one. Is there any change in color in any part? Usually at where the nipple is usually black. But when you see color change in other area, just note that one. Maybe a change in color. It may be a change like some part is just bulging out like a lump. It's just notice it. You are looking now, you have not touched. You come to that one later on. You just notice it and just notice any change in shape. It's your own breath. You are used to it. You bathe yourself every day. So when there is something new, you should be able to detect unless you are careless. Just look at it. Is there any change in shape? Is it getting fuller and you are not breastfeeding? Normally during ovulation, some women feel some thinking session and some women, different women have different things. But is there change in shape? Is there change in size? Is there a dimpling? You see something as if it's punched inside. You just go in small, as if you put your hand to put it like that. No, you didn't do that one, but just notice that it went in. And it's just like that. If there is a dimpling, if there is a change in the nipple, or you are not pregnant and you are not breastfeeding, but if you squeeze your nipple, it's bringing out like water or pus or like breast milk, and you are a young lady, you are not breastfeeding, it may be bringing that one out. If there is any change in texture, you know orange, eh? How many of us know orange now? If you look at orange very well, the back of orange, you see that they use pin to punch it like that. If you notice any of that one on your breast, you need to see your doctor. So just stand before your mirror and check your breast. That's the first one. The second part now is for you to touch. You will use the flat surface of your finger. Just use one hand to raise your breast, or you just stand and chest out, and just use your hand to rub your breast, making 0 circle like this. Just check for anything that seems to bump against your hand. The other one, the first thing was to look. Now, when you touch and you feel, you may feel hardness in some parts. In young girls, 16, 17, 18, 19, 20, 21, 22, 23, that's what we call fibroadenoma. It is not cancerous, but it's a growth. But later in the future, it can transform to cancer. It's just like a lump there. If you feel it, see your doctor. Let him be the one to tell you there is nothing there, a normal breast tissue. But once you feel round and you feel any lump, hardness, and you can then do like this as if you can hold it, please go and see your doctor. Use the other hand for the other one. Do it standing, then lie down on your bed and do the same thing. 2 different postures, standing and then lying down. Just check yourself. That is self-breast examination. So if you notice any lump, any like something hard, like a seed of maybe, what do you call this fruit with big seed that is bitter and sour, brown color, nothing about it. Or this something like peanut or something like that, just in your breast or something. Please see your doctor. If there is swelling, if there is discharge, please see your doctor. If you check your armpit, just feel your armpit, and you feel any kind of small knot inside, please see your doctor. Because sometimes that is the point some people discover they have breast cancer, because the cancer is spreading to the armpit. So it has lymph node enlargement. So this is self-breast examination that you can do for yourself before you go to see a doctor. It's part of staying healthy. For men, you can do testicular examination. Your testes. I know somebody that used to work in the same office some years back. He was bathing himself and he just touched his testes, and that was when he noticed there was a hard part. He had to do surgery because God help him that if we are transferred to this testicular cancer, he had to do surgery to remove it. Sometimes it's because we are not paying attention to our body. Our body speaks to us, but we don't used to listen. Many of us that have cars, when we are driving, when you hear one sound, you know something is wrong. But our body speaks to us, but most times we don't listen. So check your body. For men, just use your thumb and this. Put your testes, just check for any knot, any hardness, or any challenge, or severe pain. If there's anything, sometimes when there's infection, otitis, it causes pain, hardness, warm, so you can see your doctor. Another one is weight and waist measurement. That's talking about gaining too much weight. You can just use your normal tape rule about your belly side. Just use tape rule to measure it. Usually in men, it should be nothing like more or less like 94, less than 94 or 90, but if it's greater than 94, it's tending towards obesity. For women, if it's greater than 80, just know that it's tending towards too much body fat that can be disposed to hypertension, that can be disposed to diabetes and some other things. Check your blood pressure. After today's service, somebody will be around. You want to check your blood pressure or blood glucose, you can do that one. So if you have urine. If you go to toilet to pee, check your urine. We are talking about self-body examination now. If you notice that your urine is cloudy, you may need to see a doctor. You know what I mean by something is cloudy, but it's not clear, like water. It's like milk color or something cloudy, as if you make a small amount of milk in water. if it's cloudy, if it's reddish or bloody, this one you are not doing test now. You just notice that, or when you pass urine, the urine flow out, but the last drop you see like blood or reddish color discriminatory drop. If when you pass urine you feel pain, women or men, all this, I'm talking about urine, I didn't say men urine, women urine now. Whether you're a man or woman, you notice all those changes, please, it may be sign of infection or sign of something going on in your bladder, sign of something going on in your kidney. Urine is the eye to the kidney, the ureter, the bladder, and the sexual area. It's very important for you to do that one. Another one is, mental checkup. You can do mental checkup for yourself. Just check yourself. Am I sleeping well? That's mental checkup. If you notice that you're not been sleeping well, why am I not sleeping well? Just get all of them together once. No other one. Thank you. So, do I feel unnecessarily sad? Have I lost interest in what I used to enjoy before? You ask yourself, do I get angry easily these days? Just get irritated, and later you ask yourself, why was I even angry in the first instance? Those are emotional issues. Those are mental health and mental illness. It's very, very important. So carefully note, I've talked about self-body examination now, not going to doctor. So carefully note any of these. If there is necessary, discuss with your doctor and then take necessary steps. I'll go next to family health self-examination. Look into your family. Many of the diseases are what one can inherit from our parents. Talking about gene that you can inherit from your parents. So, is there any disease that affects your dad or your mom or your grandfather or your grandmother or your auntie? Something that seems to run in the family. For example, hypertension can run in the family, apart from different causes. Diabetes can run in the family. There are some diseases, breast cancer run in the families. Somebody have it, most like somebody else may have it. High problem, there are some high problem that runs in the family. Just look into your family. Is there any particular disease? Then you start checking yourself, you start watching out. Go and read more about that thing. What are the preventive factors? Like if somebody in the family has died or has breast problem, that gives you an example that you should start doing breast examination for your family before there's anything. So family problem, any disease that is common to your village or the town or the city where you came from. There are some locations that have some particular disease. If you live in hilly area where there are a lot of mountains in your side, when you were before, you wash away most of the nutrients in the mineral away. So most of those people living in such area, they have iodine deficiency, thyroid, you see them growing thyroid gland. Almost everybody in that town or that area, even if they live away after some time, sometimes. So there are some locations in the northwest, Zamfara, Kebbi, due to some mineral or heavy metal in their water, even underground water, they be having some heavy metal poisoning. It's common in that area. There's something very common in Maiduguri that we've seen. There are many cases of kidney failure. Maiduguri, this axis, many cases of kidney failure. People have talked about the water that is being drunk. People have talked about so many. They are still investigating it. It's so much rampant. That's the location. So just look at your environment. Is there anything common? Just note it and check. If you notice anything in your family or your area, be conscious of it. The last part I'm going to talk about, I'm looking at my time now. Avoid stimulants, alcohol, and drugs. Each time I pass this road, from the church gate to the main road, I feel worried. Because I see a lot of these small bottles. You know, these grey and brown bottles scatter everywhere. These days, there are a lot of energy drinks. Remember when we started, I was telling us that we have more disease in our youth compared to past year, and I have fear for the next 5, 6, 10 years in this country. There will be an epidemic that is worse than malaria. When we still have so many liver problems, so many kidney problems, it's already happening. But it's going to be worse in the next 10 years, 15 years. Because by then, so many livers will have been damaged and kidneys will have been damaged. If you are walking from church, if you have not come with your car, don't ask your going, just look at the floor. This is this road only. Check everywhere. Lot of energy drink. How many of us know about Fearless? You've seen Fearless before? Energy drink. Powerhouse. Red Bull. Bang. Monster. So many energy drinks that contain high caffeine and ethanol. Many of them are being produced with little or no NAFDAC registration. And sometimes these days, if you have plenty money, you can even bribe your way through your product to get approved. And once it's approved, the first one you produce, usually the good one, most of those manufacturers, the subsequent one, they compromise, and the quality is not the same. What they say is inside is not what they say is inside. There is mafia coffee liquor. How many of you know about it? With them, you don't know about it. Many of us are not being honest. We all know it. It's very common. What about Sazu? We don't know that one too. Ha! Jesus Christ. Hallelujah. Somebody. You don't know Sazu bitter? Ha! Okay. Tell me the one you know. No, I didn't say the one you drink. This is enlightenment. I've never drunk any of those. When I was coming to church this morning, I picked some of those bottles and I checked. Do I drink it? No. Knowledge. Are you getting what I'm trying to say? So, many of the energy drinks contain caffeine and ethanol. Red Bull contains about, I think, 160 milligrams of caffeine. Powerhouse contains 300 milligrams of caffeine. And then this mafia coffee liquor, or what they call that one. That one contains 30% of empty alcohol. Now, do you know, all of us know beer, eh? Let me see somebody that will tell me doesn't know beer again, because I know some of us are just saying. You may not be drinking, but your friend drink. Two of us. What is the alcohol content of beer? Huh? There are many smart people here now. We are not drinking for information here. 5%. Alcohol is 5%. Guinea is about 4.8%. It's what? 10. 7. Thank you. That's why I deliberately say what is low. Some of these, like this, what's it called now? Sasu bitter contain 30% ethyl alcohol. Go and check the bottle. 30%. Beer, one bottle is 5%. Guinness 7. That small bottle comes 120 ml as 30%. Check the bottle to see. Many of those small bottles have very high alcohol content. And those things, I will tell us what they do to the body. So if you are taking it, most of this energy drink, we are harming our body. Serious danger that is waiting to happen. And it is addictive most of the time. Of course, they will tell you that, oh, it prevents, many of these brain, small, prevent premature ejaculation, is energy booster, is an extra power, it causes penile enlargement. There are so many reasons to drink it. But the danger they cause to the body is worse than any benefit that you can get. I'm laying more emphasis on it because it's very common among youth and it's terrible. Now, it causes health problem. I will start with the heart problem. It can increase the heart rate. It can cause irregular heartbeat, what we call arrhythmia. Just see your heart, boom, 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 stop. You continue to beat normally. At times, you just as if, you know, if something drop here now, boom, everybody, our heart will do what? Will skip. If nothing happen around you and you just see your heart beat, boom, you need to see a doctor. Prolonged taking of this, some of these drink and stimulant, we call arrhythmia. That symptom, irregular heartbeat. Then the person stands the risk of cardiac arrest, over long period, the risk of heart disease. It causes high blood pressure. It causes anxiety and panic attack. If you be taking all those drinks, you notice that you'll be restless. How many of us have those people that drink all those drinks? They will just be restless until they take that same drink, then they will become calm. There's something we call withdrawal effect. Restlessness. It can cause what we call a panic attack. It can cause nervousness. You are just nervous. It can cause headache. These are some of the side effects of some of these drugs. It can cause sleep problem, insomnia. Somebody will not be able to sleep, or sleep will not be able to sleep very well. And when you don't sleep very well, chronic sleep loss can lead to loss of concentration. It can lead to weak immunity. It can lead to mood problem. Then it can cause increase in blood sugars because and then that one can produce somebody to diabetes. It can lead to insulin resistance. It can lead to addiction. You get addicted to it and you cannot stop. And then it causes more problem. It can lead to mental health issue, irritability, mood swing. 1 second you are happy, next second you're just angry, lead to aggressiveness, lead to depression. It can cause impaired memory for a student. You forget things. That's some of the side effects of this. But what's more, it causes liver damage. So if you are taking anything that contains all those energy drinks, they contain caffeine, they contain niacin, they contain taurine. Those are dangerous components of those drinks that damage the liver. See, the liver is the workhouse of the body. Anything that you eat is one that detoxifies it, that keep you alive. But once liver start having problem, the only solution is liver transplant. Does anybody know the cost of liver transplant? Do you know how I have an idea of liver transplant? Range from 20 to 400 million. I don't know how much of us you have in your bank account as a young man. I know sometimes when you call people to help you with some problem, when they know the cause of the problem, they say, well, after I finish drinking, it's like something that will waste money. But it's a small child that needs liver problem. Maybe you want to do something. There are some people that they look at your life, you just say, well, no point wasting money on this one. Once liver fails, there is nothing. There is nothing you put in your body that your body will be able to manage it because that is work. Food, water, any toxin that anything, that's work of the liver. The kidney that does its own to excrete it. So once, and that is what all those energy drinks does, they damage the liver. I hope somebody is learning something today. It's better to learn from other people's experience than to learn from your own experience. Today, you are going to school, you are going to become somebody in life. When you start making money, don't let health be the issue that will deny you enjoyment of your money. Because when you get to 40, 50, that some of those problems will start. And at that point, you'll be managing it. The money is there, but you are wasting on something else. So it's very, very important. The risk of overdose is there, seizures, convulsion, tremor, death, and then poor judgment. In conclusion, take care of your body. 1 Corinthians chapter 6 verse 19 to 20 talk about that one. Your body is a gift from God, hence stay healthy so that you can fulfill God's purpose for your life. It's your spiritual responsibility to stay healthy. For your family, for yourself. Don't go and die unnecessary death. Take care of yourself. Some people die 40, 50 for preventable disease. And they leave their wife with small children. Body for the family. For something that is preventable. So please, let's manage our health. Watch how you use your body. You will give account to God. The wish of God for us is to be healthy. If we read John verse 2 and then Deuteronomy chapter 7 verse 15, Bible promises us no sickness. And if you are sick, God promises us healing. Jeremiah 30 verse 17, Exodus 15:26, Psalm 103 verse 2 to 3, and Isaiah 53 verse 5, Matthew chapter 4 verse 23. They are all scriptures that talk about healing. So there is no problem if you have one sickness or that you can pray to God, God will heal you. Talking about prevention, Proverbs chapter 3 verse 7 to 8. There are many of these diseases you can prevent. Ecclesiastes chapter 7 verse 17 it says, don't die before your time. Read your Bible, is there. That means that even sudden death, premature death, the Bible recognizes that somebody can die before his or her time. And these are some of the good fathers. So don't die before your time. 1 Corinthians chapter 6 verse 12 says, all things are lawful, but not all things are expedient. Something may not be a sin. That was why when Daddy said the other time, those that keep name, it is not a sin. But can it cause problem for you? That's what you should think about. That's what the Bible says, all things are lawful, but not all things are expedient. If I'm going to wear a cloth, it's very funny, and I used to do that when I see it. Before leaving your house, you know the clothes you are wearing. And now when you come down from keke, you are now stretching the thing. What are you stretching? You know that the thing is short before you wear it. So why are you now trying to pull it down? You understand what I'm trying to say? So there are some things that you are the owner of your body. You are the one that own it. So decide what you want for yourself. So it's not a sin to have non-vein, but if you bring typhoid or bring infection for you, you manage it. So prevention is better than cure. I will stop here. Do we have any question? I will quickly go through. I'm sorry, I overshoot you. Do we have any question? Is anybody bold enough to ask any question? Otherwise, I will just quickly take this one. Please, what causes high fever that might lead to mental disorder? What also causes seizure? Now, high fever is just a symptom of something is wrong in the body. Fever is not a disease. It's like a representative of a disease. So when you have fever, that's why so many things can come. If you have malaria, you have fever. If you have typhoid, you can have fever. If you have cold, catarrh, upper infection, you have pneumonia. Fever is just a way of your body trying to protect itself, trying to set up itself, and then some jam too. They cause the brain to reset the thermostat in the hypothalamus to increase body temperature. So fever is not a disease, it's just like the symptom of what is wrong in the body. Now if somebody has meningitis, now for example, he will have fever, he may have neck stiffness, he may have headache. Meningitis can be exposed to some complications because you are asking for what causes high fever by leading to mental disorder. In children, malaria can cause fever, but their body is not so strong to manage high fever, so they convulse. So if a child is having between the age of 1 and 5 years, especially 1 to 2 years, if they have fever frequently and they convulse, it's going to develop later in life seizure disorder. Can you see now, from fever to seizure epilepsy, it has a vein. Now, unless you have a disease that affects the brain, it may not lead to mental disorder. But I'll just give you an example of somebody. If you have meningitis or any sepsis infection in the body that spread to the brain that causes that problem, it can cause some form of mental issue, mental disorder, but not the psychosis that is very common. I've told you this is common because of seizures. I talk about alcohol or stimulant, it can cause seizures. Fever can cause seizures. Some people have some disorder, epilepsy. Some of them are inherited. So those models one can cause seizure. There are so many other causes of seizure. I hope that question is answered. Is there any side effect of taking family planning as a single lady? It depends on the kind of family planning you are taking. Now, as a single lady, if you are taking family planning, the first advice I will give to you, if you are a single lady, do abstinence. That's the best family planning. Because once you don't have sex, how can belle come? Abi? But if you cannot hold body as a talk, that's another pastor will address that one. I'm not here today. Maybe next Sunday when I preach, I will address that one. But today, somebody else will. Today, if you don't fit hold body, protect yourself. You can do family planning. Now there are different types of family planning. We have the barrier method. Men use condom. There's female condom. I hope you know. Now let me tell you something. Now this is forget spirituality. Now that's why I'm standing at this side of the. Those people are very spiritual. I will join them after leaving this place. That's why I'm standing here now. We have. This is for your knowledge. You must know. Ignorance key. So read about it, don't do it. Don't say because I'm not sleeping around, I'm not having sex. Why should I know about family planning? You are making a mistake. You can cancel your friend. Later on in life, you can. So this is what we have. Male can use male condom, female will have female condom. Those are barrier methods. Thank you. So you can use female condom. That's one family planning. That's little or no side effect. You can use pill, tablet. There are different types that you can use, but some of them have some side effects. They can make your menstruation to become irregular before later on it can become regularized. Some of them can make you to gain weight a little bit. If you take it, you can put on weight. So that they will prevent pregnancy. But these are some of the side effects. Because the person is asking about side effect of the hormone. So there's another one that the IUCD, they will insert it through the vagina into the womb. That one we have to play, we call it copper T, IUCD. If you just stay here, some of them are just pain. You will not gain weight, you will not do anything, but it prevents pregnancy. It's a family planning method. We have implants. They are found that they will start one small thing, smaller than the size of a broom. They will just put it here. Next 5 years, you won't get pregnant. If you want to get pregnant, you remove it. So they are different, but all of them have different side effects. Some of them, if you want to get pregnant, if you remove it immediately like the IUCD, most likely you can easily get pregnant. Some of them may prevent pregnancy until about 6 months. Once you remove it, once you stop taking the drug, we have the injectable. Sorry, I forgot about that one. We have the injectable. Take once a month. So they are different. There are some you take 3 months. So they are different types. That's why when you go for family planning, they first counsel you. They will know the one that is suitable for you. They will know the one that is not suitable for you. Then that way they will then decide the effect, and then you can decide which one is best for you. But to answer your question, I will come back to the pastor's side. The best, that one has no side effects. Abstinence, abstain from sex. We are simply, what are you doing with sex? Somebody is looking at you with corner eye. If you look at me with corner eye, I will tell you are not from. Even my children look at me with corner eye sometimes when I. What is he talking about? What will cause headache? Like it comes once in a while to someone. So many things, just like fever. many things can cause headache. Eye problem can cause headache. If you use glasses, usually yearly you should do eye test. If your lens needs to be changed, you will start having pain, especially around this side or which part of the eye. So it can cause headache. Fever can cause headache. There is an infection going on in the body. Upper respiratory tract infection, viral infection can cause headache. If there is cancer in the brain, somewhere or a tumor or lump in the brain, it can cause. Some people have migraine. Some food or something that we eat can cause irritation along the blood vessel. If the blood vessel in the brain become inflamed, it can cause headache. Infection, meningitis can cause. So many things can cause headache. So when you have headache, you need to check: is there any other symptom in my body? Is there anything? When you have the headache, if you, some of us that are very close to our computer, if you look or watch TV for long, it can cause headache. If you don't sleep enough time, you don't have enough time and sleep, it can cause headache. One of the commonest and simple symptoms, telltale of hypertension, is headache. Frontal headache. That is one. Hypertension is a silent killer, but one of the symptoms we used to give is headache. Are you getting that? So many things can cause headache. So you just want to know, you can decide what will cause leg pain. If I kick my leg again, because your question is what can cause leg pain, if I kick my leg again, this thing, I can have leg pain. If at the joint, arthritis can cause pain. Muscle can cause leg pain. You have in this leg, you have bone there, you have muscle, you have nerve, you have so many things, you have tendon. Any of those ones, if there is problem with them or pain or something, can cause pain. So I think that should. Otherwise, if it's more serious, doesn't cost you anything to see your doctor. I'm trying to run now. How do I know that my sperm is okay as a young guy? Thank you. You are laughing. Now, serious matter. The question somebody asked, you are laughing. Yeah. It's a very simple but very important question. Now, how do you know that your sperm is okay? Now, there are some things. If normally sperm is a little bit thick, small, it's not supposed to be watching. Because the way the sperm is made up, it contains cells, contains some liquid. It's supposed to that's not like yogurt. It's not supposed to like flow like water. Something thicker a little bit. Even like a gel, like toothpaste, sometimes like that. It will come out that way. After few small minutes, it will now start melting to become watery. That is normal. But if your sperm does come out watery, that will be a problem. I'm not saying you have a problem, that will be a problem. But the best way to know if there is problem with the sperm is to do a sperm test. Semen, you go to the hospital, they will collect your sperm and you check. They will check for sperm cell, spermatozoa for male, to check the head, the color, whether you get tail, whether you get neck. It has head, neck, body, and tail. If it has head and neck, it doesn't have tail, it's not going anywhere. Even when you sleep with a woman, the sperm remain in the vagina, they are not going to move anywhere. Where they are going to fertilize the egg is inside the woman, not outside. So the tail is very, very important. If the egg is deformed, well, so semen analysis is the best way for you to know. If you tell you, they will measure the amount of sperm. There is a quantity of sperm a man is supposed to produce to fertilize a woman. There is a number of sperm that a man should have when you ejaculate before you can impregnate a woman. You must have between 60 to 120 million sperm in one ejaculate, and the only one that is needed. So between 20 million, 60 million, and above. If it is small, but you can use that on true count, somebody will not be able to. I'm not saying that's why it's not about those sperm count. Two of us. Yeah, but then you have to run some tests before you know. But the one you know is that if you pass your sperm and you see color, normally you should slight milky color, but it's now yellowish or change of blood stain, then there's something else is happening that is not supposed to be there. If there is otitis, infection of the testes, I mean, so many things could be wrong with that one. So you may need to just, yeah. What is the cause of fibroid? It is normal for a young girl under the age of 30 to have fibroid. Thank you. Fibroid is just a growth in the womb of a woman. And usually they said the womb, the way God made it, his job is to born baby. So sometimes they tell you, if you don't give me baby, I will give myself baby. That's the way they used to teach us in university that it is meant to give back to a baby. But sometimes because of hormonal imbalance, the men and the women, we have different hormones. We have the one for women, we have for men. Some of those hormones, I'm not going to detail of those ones. If they have imbalance, they can cause stimulation of growth in the muscular wall of the womb. It can cause fibroid. So it's a growth, it's like a tumor because it's a growth. I'm not saying it's cancerous now. Growth can either be benign or cancerous. Normal growth, cancerous growth. Somebody may have growth, the liver, the thyroid gland big, may not be cancer. It's just there, big 70, 80 years, it's just there. It's not cancerous. So the same thing with fibroid. It's a growth in the womb of a woman. Yes, somebody less than 30 years can have fibroid. You can have fibroid, doesn't mean that you're not going to have children. Depending on where the fibroid is located, depending on the size, depending on the kind of fibroid. My wife had fibroid, and we had our 3 children. She had surgery a year and a half ago, so we wanted to do full workup before she had the surgery. She had thyroid enlargement, and we did surgery for it. We did the scan again, and the fibroid is there. And I said, you are still there? Okay, we'll remain there. Because when she was to deliver, when she was pregnant, she went to see the doctor and the consultant. First of all, said that she may need, because the fibroid is there, blah, 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 maybe we need surgery for the baby. Then we met one doctor, a deeper life doctor, said, don't worry, we'll give back to your baby. She had her first child, second child, third child. All of them are heading here now, they're all teenagers now. The fibroid is still there. So the fact that you have fibroid doesn't mean that that's the end of the world. Are you getting it now? Depending on the size of the fibroid, the type of fibroid, the location of the fibroid, so many other things. So don't get panic, just see your doctor. That's the best advice I'm going to say to that. When I lay down and rest on my chest, I feel pain on my chest or heart, and I don't know what used to cause it, but I will change my lying position and I will be okay. You have already discovered some of the solutions to your problem. Sometimes, depending on your position, the stomach contains gastric acid. So, if you, depending on the position you take, if those acids start coming up towards the point where they join the esophagus or they sit in, they cause irritation because there are different epithelial cells between the esophagus and the stomach. Once those acids get there, they irritate, they cause pain. So you may feel pain around there. Sometimes when you have ulcer, you feel pain there. So when you lie in that position, the acid gravitates to that point. Once they touch the surface of the wound, you may feel pain. Sometimes the muscles of the chest, because we have muscles here, we have bone on the abdomen, we have muscles here. Pain, the pain can be from there. But check yourself, there should be other symptoms. If it's going to be the heart, the pain will radiate to the shoulder, to the neck. That's a pain coming from the heart problem. Usually it radiates to the shoulder and the neck. Or I see constricting pain in the chest. Those are other ones, but I will ask you to check, look for other symptoms or other things, or you can see a doctor. But I think if you change your position, if you sleep on very hard surface, or depending on your posture, you actually get chest pain. So these are some of the things that cause that. How do you maintain a healthy diet on a low budget? Very easy. You don't need, how much does vegetable cost? Vegetable, fruit. You don't need plenty money to buy fruit. True of us, vegetable, fruit. If you eat natural things are cheaper. The same amount of money you need to buy a sausage roll or hot dog or what's it called? If you go and use to cook nice semo and gusi, you will chop like better. So natural food are cheaper. You maintain healthy diet through natural food. They are cheaper, low budget. You don't need to spend much. Natural food, just go for natural food, vegetable, fruit, and all those what could be the cause of someone urine having a sweet or fruity smell? It could be from what you have eaten. What you eat, some of the things that we eat have additives inside. They have coloring agents, they have other things. So it could be from what you eat. Sometimes it could be some sign of some funny infection. And then sometimes if your urine, if your body, if you are dehydrated and a lot of what you are passing in your urine is in concentrated urine, you may feel some funny symptoms. But if you don't have pain, if you are passing urine, if you pass urine freely, if you don't have discharge after you pass urine, there are many other things that will point to more problems. So it won't just be like sweet smell, and it's good that you're even smelling your urine. That's a good one. I appreciate the importance of smell when I had COVID. When COVID, I could not smell. So the fact that you can even smell, you thank God for that one. So smelling is very good. So if you smell it, make sure you're not smelling your perfume. You go and use perfume and then you are smelling something. I don't know what you are smelling. So just check what you eat, check the cream, rule out, before you start thinking about big problem, rule out simple things that you do normally first. Then if there are other problems apart from just smelling, there's some STD, it smells like fish. See, discharge smell like fish. So there are some STD that sexual transmitted disease that smell. So there will be some other symptoms that will accompany it. You may have waist pain when you pass urine. You may have sore in your private part. There will always be some other thing that will point towards some other problem. So unless if it's more than that, you need to see your doctor. What causes body and mouth odor despite all personal hygiene? Mouth odor can be caused by if you have, when we eat, there are food particles that still remain in our mouth. They get lodged in the small space between the teeth and the gum. Sometimes they are rich in sugar, they get fermented. As in, when you close your mouth, there are some anaerobes, microorganisms that are in our mouth. Normally they are there, they are not causing you any problem. But they thrive on sugar. So as they decompose small particles, those film or blue particles, the odor come out. Sometimes an infection in the back of the mouth. We have places where there are small glands. If they are infected, can cause mouth odor. Some disease can also cause mouth odor. So there's a lot of things. Buy hydrogen peroxide. Go to any chemist, they have it. When you take small, it will foam. You just gargle your throat. Do it about 2 or 3 times. You can dilute it. You can use Orale mouthwash. You can put salt in water and gargle your mouth. Make sure that you can eat mint. This mint. There are so many things you can do. You can see your dentist. Sometimes there's infection. If you have hole in your tooth, there's an infection going on. You can bring pus inside. You can bring so many things. You can bring that one. So improve your mouth hygiene. If you go out small 1 hour, just drink water. Just open your mouth, spit it out. I mean, little things that we can do to brush about 2 or 3 times a day. there's a friend of mine, a medical doctor too, that has extra brush in his bag. He carries to work. He just go to the bedroom, brush his teeth again. During office hour, there is nothing. Nobody knows. You understand what I'm trying to say? Because that time we were sharing office some years back when I was working in Abuja. So nobody knows, but he knows that he has mouth odor. You brush your mouth and take some of those precautions. That will be fine. Say, single lady, is it advisable to freeze your egg? Why do you want to freeze your egg? That's the first question. There must be a reason. Is it fear that you understand the question? Freeze. Each woman produces egg every month. That's part of the menstruation. But in the ovary, some people, because of future problems that maybe they are not able to have children, they will go to hospital. They can collect the egg and freeze it. Next 30 years, you can bring it out. They will put it there. They still fertilize it. It doesn't. They store it with nitrogen. But the question is, why do you want to do it? Is it because of fear? Is it because there is a medical condition? You are not producing enough egg. You have seen a doctor. They say you are not producing enough egg. The one you produce now, if that one is happening now, you want to harvest and keep, and later in the future you use it as in case if that disease. There are some diseases that can cause that one. So you just harvest it, you keep it. In the future, if you are still producing egg, fine. If you are not, you go back, you put it, you do artificial insemination, you do IVF, you still give back to children. IVF is not a sin. It doesn't mean that you don't have faith in God. I'll come to this side of that one. It is not a sin. So don't, for couple, because there are many people, I give an example of a sister that has not been sexually producing anything. If you took this blood on so many other complications, some people have problems with their womb. So many things can make somebody not to be able to fertilize normally, or so they can do IVF. Are you going to see that person as because of sin? No, IVF is not a sin. So let's keep that one at the back of our mind. So you must know why did that is the question. Why do you want to harvest? Because it's a procedure, and every procedure has a side effect and danger. So why do you want to harvest it? Where do you want to keep it? Who is keeping it for you? For if you come back and it's no longer there, but they gave you somebody else's own. So ask yourself, why do you want to do it? If it's fear, what is causing the fear? Is that something you are doing now that makes you to have that fear that without it, but in the future you don't have, you need to have collecting back to children? I mean, that's the first question you have. If it's due to medical condition and you are advised by a doctor, please go ahead. But I'm going to say this. Let it not be for money. It is going on around now, very rampant in many major cities. Young girls, university students, young women, they will go to gynecologists, they will harvest their egg, and they will give you money, 100,000, 200,000, 400,000. You sell your egg. I hope it's not that one. Every woman earns the number is going to produce choice and last sperm. Go and work with. There is a amount that is needed for you to be fertile in life. Be very careful. So that you want to, that money that you are going to collect now, you buy it later with somebody else's egg. Be very careful. Lagos, Port Harcourt, Abuja, maybe it's even happening in Maiduguri here. Young girls, it's not a major surgery. The hole they will put in your stomach is not to one small part. It's not to chinkly hole like that. They will harvest it. They will pay you money for it. I'm not teaching you bad things. I'm just trying to, because that's why knowledge is very important. Even as a Christian, you must have knowledge. Your friends, they make easy money, but then the effect will be there in the future. So I hope that is not the reason. I brought that one out. I'm not saying that's why you want to do it, but I just want to quickly clear that one as a doctor. I hope that's not that one. But then there must be a reason why it is fear. Pray to God. If there is a disease, see your doctor. If they say that, look, the way you are losing your egg, by the time you are 25, you will not have any egg again. If they want to harvest what you are producing now, let it be a level hospital. They have it in Nigeria. You store it, register it, everything. The whole process is there, and you can always have it. Soldiers do it when they go to work. They ask them to drop their sperm. Later on in the future, I don't know whether they do it in Nigeria, but most foreign countries, you want to drop it so that even if you die, your family can still have a baby. Going to the gym to build your body, does it have any side effects? No, you do it gently without steroids. Most people that go to the gym do steroids to boost the muscle. Some of us, that's why some of these sisters, you don't look at people like God that don't get muscle. You're always looking for people with big arms. Some of them use steroids to boost. If you boost it very well, but it also has side effects on the body. So you can go to the gym, normal workout. Over a period of time, you do it gradually, you will sustain it. Don't use steroid or drug to do that, so it's not wrong. It doesn't have side effect if you do natural building of muscles. Last one I have, okay. Is there any side effect of taking family out? What is the relationship between faith and our health? I will first talk about faith and assumption. Sometimes you think you have faith, but you are assuming. Faith is nothing is happening, but you believe it's there, you are saying it. Assumption is I think it is there. Now, the word of God is there. Bible says the righteous shall live by their word. By what? By your faith. See, some of us think we don't have faith. How many of us, when you want to enter Okada now, you get brake, your brake good. You just believe that this man, so long the keke is on the road, his brake is good. You just enter. Two of us. I mean, for every one of us, there's a level of faith that you have, but you can build your name. You can ask God to build your faith to believe God that you will not be sick, you will not be sick. But at the same time, it is not a sin if you are feeling sick to see a doctor. There is no relationship between faith. Your faith can work for you to prevent disease so that you don't get sick. Bible says that no inhabitant of land shall say, I am sick. Bible says that no disease of Egypt, I will not allow any disease of Egypt to come upon you. So there are many Bible passages. Bible talks about no pestilence and day night, no disease will come. Those, and you believe strongly to it, you will not get sick. You don't have to use glasses if you have faith. So your faith can work for your health. But your level of faith have not reached strong enough to get you your miracle. Take your medicine. We have lost many people for that. Many Christians died because of that one. Please, what are the steps to take care of? I'm not saying this clearly. What are the steps to take care of? Is the dental problem or this is not clear. Sorry, I'm using glasses. Sorry, I'm not seeing this clearly. The writing is not the issue. No. Why does one consciously feel digestion? Is this digestion? Please, these are normal questions. I want to be ashamed about. They are normal questions. If you are the one that wrote this, I'm not saying what. If you are the one that wrote what's the relationship between faith and health. The other two questions I'm not clear about this, so I don't want to assume, so I will not be giving you wrong information. Or you can see me, please, because I'm not seeing what I'm not getting it, so that I will not be giving you wrong answer. Those are all the questions that I have. I think there is no other question. Praise the Lord. Let's close our eyes and let's appreciate God for today, for His word, and for what we have learned. The Bible says in Ecclesiastes chapter 7 verse 17, say don't die before your time. 1 Corinthians chapter 6 verse 12 says that all things are lawful but not all things are expedient. I don't know what you have had today. I don't know how you are using your body.
Are you using your body in a way that will harm you now or later in the future? Are you using your body in a negative way? Are you abusing your body? Substance abuse, sexual abuse.